Welcome to this Town Hall edition of Straight Talk Africa. I'm Heidi Adams. I'm so glad you're with us. We have a very special program for you this week. You'll remember it's been more than 2 years since Chinese authorities first alerted the World Health Organization about a mysterious virus. Could you have imagined the global, generational shift we've experienced since then? More than 5 million people dead and the world shaken to its core. As we enter year 3 of one of the worst plagues in history, could the end actually be in sight? About 4.8 billion people worldwide have now received at least one dose of the COVID-19 vaccine. Of course, who has access to those vaccines is a major controversy in many parts of the world, especially in African countries. In the next hour, we'll take stock of the damage this virus has inflicted on our families, our communities, our health systems, and our economies. We've brought together African experts and thought leaders to share their perspectives about where we are in the fight against COVID-19 and what's needed for African nations to respond, recover, and rebuild. We begin our coverage with our VOA correspondents who have updates on the state of the disease in South Africa, Kenya, and Nigeria. We'll also have news from the White House in Washington, D.C. We've got analysis, in-depth reporting, and answers to your questions about COVID-19, the virus, variants, and vaccines. Let's start our coverage with our team in Africa.
I'm Linda Giftash in Johannesburg, South Africa. The country is emerging from its 4th wave of the coronavirus pandemic, driven largely by the Omicron variant. Compared to previous waves, Omicron has been mild. Hospitalizations were far lower than during the Delta or Beta waves, as were the number of deaths. And that's despite no change in restrictions to daily life. South African scientists have said it could mark a turning point in the pandemic, with high case numbers no longer resulting in a spike in deaths. It's a relief for the public that's feeling lockdown fatigue. Scientists say immunity through prior infection and vaccinations helped reduce the impact of Omicron. But vaccine rates are far short of government targets, with less than half of South African adults having received their shots. It's come at a high price. South Africa has the highest COVID death toll on the continent, with over 93,000 lives lost. When excess deaths are taken into consideration, the country's Medical Research Council says the toll is closer to 300,000. About 3,000 vaccination sites have been set up across the country, but the health minister said this month that the campaigns to encourage people to get their shots have not been as successful as planned. While South Africans are desperate for life to return to normal, the health department warns that vaccines must increase for that to happen. Nationwide mandates have yet to be introduced, but companies and institutions have moved ahead with their own policies. Booster shots are also available. Future waves of the pandemic will test whether efforts are enough.
I'm Brenda Mulinya in Nairobi, Kenya. In just 2 months, Kenya will be marking 2 years since the first case of COVID-19 was detected in the country. The Kenyan government then instituted a series of measures aimed at keeping her citizens safe from this disease. This included a ban on international air travel, the closure of schools and institutions of learning, a ban on public gatherings with the exception of a few instances, and even then, the number of people allowed to attend was limited. So far, 319,000 cases of COVID-19 have been detected in the country. 5,400 people have lost their lives to the disease since the first case was detected in Kenya. The government has been ramping up its efforts to vaccinate the masses in the country as it seeks to slow down the spread of the pandemic. Up to now, 11 million doses of the various vaccines for COVID-19 have been administered here in the country. Currently, the government is dealing with issues of vaccine hesitancy, especially in the rural areas and in the arid and semi-arid areas of the country, where masses there are still concerned about the misinformation that greeted the coming of the vaccines last year. The government is now conducting civic education to ensure that these people see the importance and actually buy into the idea of getting these vaccinations. Towards this end of ensuring that the country gathers or acquires herd immunity, the government says it is hoping to have vaccinated 60% of its population, that is about 30 million people, towards the end of 2022.
My name is Timothy Obiezu in Abuja, Nigeria. Nigeria is currently recording a steady flattening of infection surge triggered by the onset of the Omicron variant, which began here in early December. The discovery of the variant marked the fourth pandemic wave in Nigeria, increasing the country's COVID infections to more than 250,000, with over 3,000 COVID-related deaths. In November, Nigerian authorities responded to increase in infections by launching a mass vaccination campaign. Nigeria had struggled to get jabs in arms for many months since commencing vaccinations in March last year. Authorities blamed myths and misinformation about the virus for the slow uptake. Like many African countries, Nigeria remains far behind on the vaccination chart. Nigeria has administered about 18 million doses of coronavirus vaccines, meaning only around 4.5% of the population has been fully vaccinated. Nigeria needs to vaccinate at least 111 million people to reach herd immunity, and unless more citizens overcome hesitancy and accept the vaccines, Nigeria will miss vaccination targets and many people will be at risk of the virus.
Well, here in the United States, there's been a surge in COVID-19 cases driven largely by the highly contagious Omicron variant. The administration of President Joe Biden is combating COVID at home, with the United States averaging over 700,000 new cases per day. At the same time, President Biden has had to honor his promise to help vaccinate people around the world. Let's cross now to the White House.
I'm Patsy Widakuswara, VOA's White House Bureau Chief here in Washington, D.C., giving you a recap of the Biden administration strategy in combating COVID around the world, particularly the African continent. The U.S. is by far the biggest donor of vaccines in the world, pledging more than 1.1 billion doses, and so far delivering about a third of that, 365 million doses. This is part of President Joe Biden's promise that America will become the world arsenal of vaccines. 111 million of those doses were donated to 43 countries in sub-Saharan Africa and 27 million to 9 countries in North Africa and the Middle East, plus the Palestinian territories. Most are donated or distributed via COVAX, the global vaccine sharing mechanism. However, the U.S. and other wealthy nations have also been accused of vaccine nationalism, hoarding hundreds of millions of excess vaccine doses. When I ask Biden officials, their answer is always the same, that the U.S. will always prioritize its citizens, but can help vaccinate the world at the same time. Still, health experts I've spoken to say that Biden and other wealthy nation leaders could have done more to vaccinate the world. These experts believe that if large portions of the world's populations are unvaccinated, new variants like Omicron will continue to appear and the pandemic will continue to be prolonged. One more thing I'd like to highlight is the Biden administration's support to waive patents and other intellectual property rights on vaccines, the so-called TRIPS waiver at the World Trade Organization, proposed by South Africa and India in late 2020. The waiver essentially allows countries to obtain the recipes for these vaccines and produce them without being sued by pharmaceutical companies. After initially opposing it, the U.S. announced its support of the waiver in April 2021, leaving the U.K., Switzerland, and the European Union as holdouts against the move. But many are skeptical that the Biden administration is putting any real diplomatic weight on negotiations on the TRIPS waiver at the WTO. Talks remain stuck, and so far, progress remains dim.
Patsy, thank you very much. Now, you may have heard that the virus can be worse for those with pre-existing medical conditions, such as cancer, diabetes, tuberculosis, or HIV/AIDS. And our first guests say COVID also has a lot to do with issues that predate the pandemic, such as the state of Africa's health systems, a lack of public trust, good governance, and leadership. And joining us now from Nice, France, is Mo Ibrahim. He's an entrepreneur and founder of the Mo Ibrahim Foundation. His work focuses on good governance and exceptional leadership on the African continent. And also with us from Washington is Aloysius Uche-Ordu. He directs the Africa Growth Initiative at the Brookings Institution. Gentlemen, what a great pleasure to have you with me. Thank you so much for being here.
Thank you. Go ahead.
Mo, geographically, you are the farthest away from us, so I'm going to put this first question to you first. Now, your foundation released a research report last year, COVID-19 in Africa, a challenging road to recovery, it's called. From what you have found in your research, are we overestimating or underestimating the impact of COVID-19 on African countries and their economies especially? Can you lay out some of what you found?
We're actually very much underestimating what's happening in Africa. To start with, the WHO Health Organization says they estimate that out of every 7 cases, only 1 is registered or detected. So the numbers we see, you need to multiply them by 7 to understand the size of the pandemic there. The problem of data is masking the severity of the pandemic. Health service has been under strain. It's already weak. Unfortunately, we have not invested enough in our health services, and we spend like 1.9% of our GDP. The average worldwide is 5.9. So we're spending very little from already a small GDP. So we have some problems there in resilience, and of course we have brain drain. I mean, in the UK, 10% of the doctors in the UK are from Africa. Actually, nurses are much more. So that's only UK. So a lot of our health workers actually and medical staff are working also abroad. So that adds to the problem. Education, our kids could not go to school, but at the same time, you could not learn at home because you don't have tablets or don't have internet. Is a problem. We told people to stay at home, but we did not send them any money. You guys in the rich countries ask people to stay home and send them the checks. You supported business. You borrowed trillions of dollars to support both people and business. This did not happen in Africa. So the economic hit also has been extremely bad. Unfortunately, also the vaccine situation and the silly vaccine nationalism or vaccine apartheid did not help really what's happening in Africa. Out of 9.6 billion doses distributed worldwide, only a very small amount, 3.5% of that went to Africa. 3.5%. So it is really a situation which is, let's say, not pleasant just to people like.
A lot of what you spoke about now, Mo, obviously, there's been a lot of talk about how Africa has been left behind, and the continent now looking at ways to make sure that doesn't happen again. Aloysius, Brookings Institution's Foresight Africa 22 report looks exactly at the ways health systems can be more effective, more efficient at tackling not just this pandemic, but also future health crises. Has COVID-19 really been the wake-up call that we needed for governments to invest in healthcare infrastructure long-term, or are we simply just trying to survive this?
Thank you. Thank you very much for having me. I'm glad to be here with my brother, Mo Ibrahim. I think to supplement a little bit what Mo earlier said, I think a couple of things. First of all, Foresight Africa at Brookings Africa Growth Initiative, we've been publishing this since 2011. And this year's edition basically is one we have devoted to how Africa will recover in terms of economic, the health sector, gender, women in leadership, climate change, and trade relations with the rest of the world. And of course, technology, which is a major development on our continent. So every year, basically, we look at these key trends, and we have, parliamentarians, presidents, scholars, and civil society organizations, and others, industry leaders, to write various viewpoints for us. On the COVID you specifically mentioned, I think we've learned a lot of things from the last 2 years. I think, first of all, that COVID has clearly dispelled the assumption that infectious diseases always start from poor countries. And then we tend to look at Africa as the place where infectious diseases start. Well, that didn't happen with COVID. COVID started from a rich country and spread in rich countries. In fact, Africa came into the picture later on. So that's very important to recognize. And the second thing to bear in mind is that there's been this unparalleled impact on the health sector, rapid increase in the telehealth and remote case management along the lines that Mo Ibrahim was talking about. The other thing to bear in mind is that, when we talk of vaccine hesitancy, which he also alluded to, I think vaccine hesitancy in Africa is exaggerated. Afrobarometer showed that a super majority of Africans, about 79%, intend to take the vaccine. So for Africa, the issue is not at all about whether they are hesitating or what. The issue is access. The issue is access, as Mo said. So because now you have a two-track world, right? The rich and vaccinated, and then the poor and unvaccinated. So these are some of the things we need to bear in mind as we talk of COVID. In terms of looking ahead, the question you posed, I think it's important to recognize what just happened in Africa in the last 2 years. We're talking of a world that basically was moving in a completely different direction, and Africans moving in solidarity to tackle a global pandemic. What did we find in Africa in terms of evidence of that solidarity? The AU and the Africa CDC, rose to the occasion, came of age. The AU's Partnership for Access for COVID tools was set up. The African Medical Supplies Platform was established. African Vaccines Acquisition Team was also set up, and efforts led by Africa's private sector leaders as special envoys of the AU. So many of these things basically showed Africa acting in solidarity versus the rest of the world, who were completely fractured and no sense of solidarity in terms of international cooperation when the world desperately needed one.
We don't have too much time now, but I want to just quickly have both of you. Mo, I'll start with you. Based on what Aloysius has also said now, what are the opportunities going forward for Africa and for policymakers to prepare for the future and to make investments? Where should they direct their resources?
I'm quite optimistic that the pandemic, in a strange way, will help us to move forward. The first lesson we learned is that we need to really depend on ourselves a little bit much more. You take the vaccine, for example, and that will not be the first pandemic or the last pandemic. Going forward, we need to manufacture our own vaccine. We should not rely on the goodwill or the sensible behavior of others, because sometimes this is in short supply. And 99% of our vaccines and medicines are imported actually from outside the continent. This is not sustainable. So there are major initiatives now to start producing vaccines in Africa. That's possible. That's very good. Secondly, we are looking at growth model. Our growth model really is not really resilient enough. It's not provide enough jobs, and they rely too much about really trade between Africa and the rest of the world. We're not trading with ourselves. When there was a problem with the world logistics system, etc., we had a problem. We cannot rely on an economy which depends on the demand or supply from the foreign powers. We need to focus on our young people. We need also to focus on power. We need electricity. 600 million people in Africa without electricity. This is not sustainable. And we need to face the challenge that we have to power Africa with minimum use of fossil fuel. Of course, we're going to need gas, we need definitely as a transition, and that should be emphasized. young people are really the future of Africa. We need to pay a little bit more attention to that and to the issue of job creation. We welcome the introduction of the African Common Market, of the Pan-African Trade Agreement. I mean, this is wonderful because we need to start to create our own market. And finally, it's governance. It's about good governance. That is the big elephant in the room, really. We need much, better governance. We regret the recession we see in the civil rights. The space for civil society has been narrowing over the last 10 years. We have been monitoring, reporting, flagging that over the last 10 years. The pandemic, it became worse. And not less than 40 countries introduced restrictions against the media, severe restrictions over the last couple of years. That's not acceptable. We see also in some places the return of the military guys. And we need to pay attention to that as well. The world is busy with COVID and Ukraine and other places, and some of our soldiers are taking advantage of that. That's not acceptable. I stop here to give a chance to Alicia to speak to.
Aloysius, a youthful population, the Africa Free Trade Area, that's been kicked off, of course, and a few other things that Africa really has going for it, technologically and otherwise. Where would you say, in closing, policy leaders and African governments should focus their attention and direct their resources going forward?
I think it's very, very important that the political will of the African leadership be sustained, because they demonstrated incredible political will against all odds during this particular global pandemic at a time when the rest of the world was really not acting in collaboration. So that's very important. We now know that African finance ministers and African health ministers meet routinely throughout the last 2 years because of COVID. And that's something that is worth carrying forward. We need to strengthen STEM education, science, technology, because the growing youthful population of the continent, it's important that, the STEM education is really, really an area of focus, particularly for women and our girls. We need to encourage more women scientists in education. The Africa Continental Free Trade Area, which you mentioned, the biggest such integration scheme in the world, with 55 nations covering 1.3 billion people. I think it obviously was delayed by COVID, but going forward, the progress being made, absolutely the way to go. And finally, investment in infrastructure to support local research and development, investments in local biotechnology. These are the sort of things we need to do going forward on the continent.
Gentlemen, thank you so much for laying out the big picture there for us and the way forward. Aloysius Uche-Ordu from the Africa Growth Initiative at the Brookings Institution, and Mr. Mo Ibrahim from the Mo Ibrahim Foundation. Gentlemen, thank you so much for your perspectives, and I do thank you for your time.
Thank you very much for having us.
Okay, so there's the big picture, but what does it mean for you, your family, and your children? After the break, our second panel of experts will answer deeply personal questions from across Africa about COVID-19, the virus, variants, and vaccines. We're back in a moment.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Linor Moudou, in Washington, every week on Healthy Living, right here on VOA.
This is a special town hall edition of Straight Talk Africa on VOA. Welcome back. We're discussing COVID-19, the virus, variants and vaccines. And at this 2-year mark, we're taking stock of what we've learned so far and what's next. And I'm going to bring in our second panel of experts now. Dr. Ahmed Ogwell Ouma is the Deputy Director of the Africa Centers for Disease Control. He joins us from Ethiopia's capital, Addis Ababa. Fiona Atuhebwe is an immunization expert and the new Vaccines Introduction Officer for Africa with the World Health Organization. She is in Congo, Brazzaville. And also with us is Shabir Madi. He's the Dean of Health Sciences at South Africa's University of the Witwatersrand in Johannesburg. And Dr. Sion Faru is an Ethiopian-American physician who teaches emergency medicine at Columbia University in New York. Ladies and gentlemen, a warm welcome to you. Thank you so much. I do appreciate that the last 2 years have probably been the busiest in your careers. But I want to start out with a bit of a report card. And this comes from someone whose report card at school always said, Haiti is not living up to her potential. So I want to ask you about potential. I'd like to hear your assessment of not just the global response, but Africa's response as a region to the COVID-19 pandemic. What did we get right and what did we get wrong? And Dr. Ouma from the Africa CDC, first of all, congratulations on the anniversary, the 5th anniversary of the Africa CDC. So in honor of this moment, I'm going to ask you to start us off and give us your report card.
Anna, thank you for having me. Looking at where many people thought we would be, and considering the factual place where we are, my scorecard for Africa is as close to excellent as it gets. We have kept the numbers low. We have mobilized our political leadership from the very top all the way down to our technical teams. We have mobilized the public, and Africa has largely addressed this pandemic as a group. And this is unprecedented, and I will give us a very, very good mark.
Fiona Atuhebwe, what is your assessment?
Thank you very much. You know, just like Dr. Ouma said, we thought we'd be really far off the mark and would lose lots of lives in Africa. But with all our fragile health systems and all the issues we have on the African continent, when it came to the next waves that we saw after the first and second waves, we have done a great job. We put systems in place, health facilities were set up, COVID treatment units were set up, and we got to learn very quickly how to handle this pandemic. We should know that Africa is one of those continents that has been hit severely with lots of outbreaks. And we thought we were ready, but we were never ready for the COVID pandemic. But given where we are now and how we started, we've done an excellent job. And just like Dr. Ouma mentioned, rallying all these heads of states, all the political will, and all the healthcare workers together, all the necessities being put in place, we've tried. We've done a good job. We've not just tried, we did a good job.
Professor Shabir Madi in Johannesburg, South Africa has been a bit of an outlier when it comes to COVID-19 in terms of deaths and infections. How would you rate or how would you assess not just the country but also the continent's response in general?
Yeah, so unfortunately, I'm going to need to differ with my respected co-panelists. I don't believe that Africa has done a great job. And I think, if anything, we haven't learned from the experience of the swine flu pandemic in 2009. South Africa is not an outlier. What makes it an outlier is that it's got much more robust surveillance systems than anywhere else on the African continent, unfortunately. And when you look at South Africa as a country, we constitute less than 5% of the African population, yet we contribute to 45% of all of the deaths that's been recorded on the African population, on the African continent. And even that 93,000 of recorded deaths that's been identified in South Africa is only 1/3 of the COVID attributable deaths that's occurred in South Africa. So the mortality rate from COVID-19 using excess mortality estimates in South Africa is at about 480 per 100,000, which is more than twice the mortality rate in the United Kingdom. Unfortunately, other African countries haven't been able to have real vital registration data in place to actually estimate this excess mortality during the course of the pandemic. And those numbers will only become available to us probably in about 2 years from now. So I think it's a highly optimistic view that Africa has performed extremely well. Unfortunately, I think the impact that COVID-19 has had on the continent is yet to be realized, and it will only unfortunately be realized after the pandemic is past.
But differing opinions there. Dr. Farouk, you of course work in the emergency rooms of New York City, which here in the United States has been an epicenter through different waves of COVID-19. And of course, because of what Professor Madi just outlined there in South Africa, a lot of places are watching what is going on in South Africa. I must say, I've never heard South Africa being mentioned in news bulletins here in the United States as much as it has now, as all eyes are looking at South Africa sort of being ahead of the curve here with the Omicron variant. What is your assessment as a globe, and Africa being a very central part of that globe, in our response to COVID-19?
So I would like to say I somehow somewhat agree with what's been said with both thoughts. One is that I think in preparation, most African countries have done extremely phenomenal job because, you know, most African countries, me as an Ethiopian that works also for the Ministry of Health, their preparation was, compared to especially other countries, Europe and the USA, was phenomenal. That's because many African countries have been dealing with outbreaks and infections, and you know, we have the experience from Africa on the ground from, you know, dealing with infectious diseases. I would like to usually give an example. I traveled in February of 2020 from Sweden to the USA and also to Ethiopia. I'll tell you this, only at the airport in Ethiopia were screening questions placed about COVID and travel and people measuring your temperature when you arrive at the airport. When I was in Sweden and when I was in the USA, when I arrived at the airport, there was no screening that was placed at any of the entry points. So most of what we've seen in other, especially in higher income countries, has been reactionary, while Africa has done a great job with preparing for the pandemic. But of course, when it comes to response, like my colleague from South Africa said, you know, because of testing issues and testing difficulties, the numbers might not show up very well. I know the African CDC and WHO have done a phenomenal job with working with heads of state, with Ministry of Health, Ministry of Finances. But at the same time, when we're looking at, we have a fragile healthcare system in most places in Africa, Ethiopia included. And because of, you know, especially we not having the high quality critical care or emergency care, and the response, we have a lot of rooms to improve and to go. So I would not give most African countries as an excellent score, but of course there's a lot of room for improvement when it comes to the response. The preparation has been phenomenal, just like I said.
And I'm sure, Dr. Farouk, you can attest to the fact that young students in medical school are always learning that building trust with a patient is, of course, one of the first steps in successful treatment of any disease. But why has coronavirus, has this pandemic created such a divide then between patients and medical professionals? And we've been wondering whether vaccines would be more welcome if they were made for Africans, by Africans, in Africa. And I want you to listen to the following clip. Here's what we learned when we took that question to the streets.
I would trust a vaccine made in Africa. I believe our doctors have not only gone to medical school only to heal, but also to give us a best dose of corona vaccine so that our immune system can fight the corona.
Oh, why not? Provided it is approved.
I would trust the vaccine generated in South Africa or in Africa as well, mostly because I think we're doing some really good research when it comes to the COVID variant. It's transparent, it's open.
Most Africans, we think we are not reasonable enough, so we don't trust ourselves. So I wouldn't trust an African vaccine.
Yes, I would trust a vaccine produced by any African company because I am African and I love my continent.
Yes, I would trust a vaccine produced by an African company in Africa, more simply because I think they know us better. They are in the field and they will be able to find an adequate vaccine according to our immune system.
I would trust a vaccine in Africa or even globally because it's a global pandemic which now affects the whole world. So whoever has a proper vaccine which can help the immune system on a human scale yeah, definitely, 100% trust.
Mixed reaction there, but largely positive. Fiona, I want to ask you, do you believe we would see higher vaccination rates if the vaccines were produced on home soil in Africa? And not just in terms of access, but also would we see more positivity in terms of public trust? I'm sure it would make your job a little easier.
I wish I had an answer to that question, because vaccine hesitance is not just an African problem. It's a global problem also affecting the developed countries, including those that manufacture vaccines themselves. And if we are to see the hesitancy, and which has really majorly been driven by social media that has come with this COVID vaccine, it comes from the global north. This is not something that originates in Africa. When it comes to us, our job is just to pass on the misinformation and wrong information to other people. But if a vaccine was manufactured in Africa, would we see more people taking it? Maybe yes, maybe no. The malaria vaccine was studied in Africa, much as it's being manufactured elsewhere. All the studies were done in Africa. But the amount of effort we have to put in to get these communities to bring their children to get vaccinated is still the same amount of effort we've had to use with the for the COVID vaccine. Polio vaccine has been here since time immemorial. Measles vaccine has been here since time immemorial. But when a campaign is starting in a country, it's quite incredible in Africa to see the levels of hesitancy in some countries for vaccines that even our great-grandparents almost had. So would it make a difference if it was manufactured in Africa? I don't know. But again, this issue of vaccines and vaccine hesitancy is all about information, giving the communities the right information. And the problem is that the vaccine takes long to show results, because it's not like a malaria medication that someone will seek, you inject them, and in 3 days, 4 days' time, you see a difference. So this misinformation that brings the vaccine hesitance is not just in Africa. It comes from the global north and even those who are manufacturing it. So if we manufactured the vaccine, I don't want to believe, you've heard somebody say that they would not even trust the vaccine made in Africa. So the dynamics are quite several and different. The level of information that they have, the confidence in the governments. By the way, we've seen that one of the biggest problems why people don't accept the vaccine is if they do not trust the ruling governments and believe that the government, which is running this program, is trying to finish them off or is trying to finish off the opposition. So there's a lot that it goes on behind this vaccine hesitancy. Probably if we got our vaccine here, we have South Africa and a number of countries, Algeria is now, Rwanda coming in, that have signed these deals to agreements and memorandums of understandings, and Senegal, Egypt. Let us see if this changes, because now the COVID vaccine is the COVID vaccine, irrespective of where it is being manufactured.
And we're going to talk a little bit more about the vaccine production. But it's true, of course, what you said earlier, that, you know, the mistrust and the misinformation, that's universal, not just on the continent. And, you know, I'd like to play, Dr. Ouma, an excerpt for you from an interview my colleague Lenore Madu did with Dr. Amadou Hall from the Pasteur Institute of Dakar. He talked about vaccine production. She asked him a very important question here, and just so people know that the Pasteur Institute aims to produce 300 million doses of vaccines a year, targeting COVID, of course, and other diseases. But let's take a listen to the question she asks him.
In the early onset of the pandemic, many different organizations, groups, and companies work on vaccine production, but we have not yet seen one from the Institut Pasteur, which has the capacity to produce vaccines. So what has been the situation?
Institut Pasteur is one of the vaccine manufacturers, the only in Africa that is WHO pre-qualified for the work they've been doing since 1966 and way before for WHO, and making sure we have a vaccine that is WHO pre-qualified. So meaning that expertise has been leveraged by African Union, Africa CDC, to be able actually to support and build capacity in Africa to make COVID vaccine available. And this came really from the inequity that happened when it comes to vaccine delivery and vaccination in general in Africa. Our perspective is to be able to start making vaccines so fill and finish this year, and also make sure within the next 2-3 years we will be able to finalize a platform where we can do end-to-end manufacturing, and not only of COVID vaccine, but also for other vaccines that are relevant for our expanded program of immunization, for children immunization. Institut Pasteur de Dakar has been in a position to build a platform that can do different technology, including messenger RNA. Messenger RNA as one of the technology that would may be important for the future and have a lot of advantage to build new vaccines and bring new vaccine for Africa has been one of the targets. And that's why we have this collaboration and partnership with BioNTech. But also we are pursuing some other vaccine technology, like the one we're using right now for yellow fever, which is based on eggs, but also looking for other technology like viral vector to be able to deliver the best vaccine that would exist, not only for COVID, but for others.
Well, I'm not really quite sure if we get the answer to Lenore's question there, but Dr. Ouma, I want to ask you, I come from a country, South Africa, that has significant scientific research prowess. I tell all and sundry about it all the time. But I have to ask, why has it taken the continent this long to get to the point where we are now going to roll out the manufacturing of our own vaccines? Why for so long have we imported more than 99% of the vaccines that the continent consumes? And why did it take a pandemic for us to get to this point?
Tough question. I don't think I'll give you one answer why it has taken us this long, but I would rather focus on the fact that the stars have aligned for Africa to do things differently today. We have political commitment from the highest levels. We have, as far as resources are concerned, very significant commitments from governments, private sector, and other partners. And we have an industry that is ready to begin growing. We are not doing zero. We just need to begin growing. And I think the most critical thing to ensure at this stage is that whatever investment is being done in the vaccines manufacturing enterprise, it is done in a way that spreads across all types of vaccines that we need on the continent, not just COVID. This is the role of Africa CDC. We have the Partnership for African Vaccines Manufacturing, and we are doing exactly that, working with our countries across the continent to ensure that whatever manufacturing capacity we are putting in place, it is addressing all the important molecules that are required for addressing the priority diseases that are vaccine amenable on the continent. But before there was opportunity, but the momentum was just not right. And today the momentum is right, not just in Africa, but also globally, because we are producing vaccines much faster. The political commitment has been absolutely fantastic during the last 2 years. And that is what is driving this new push towards local manufacturing. Let me end by saying that in Africa, the biggest problem is not hesitancy. The biggest problems are access and availability. How do we access the vaccines and how do we make them available to those who need them? Where it has been manufactured, this I think is a premature debate, and framing a question like that suggests hesitancy, which is not the real problem in Africa. Our studies show that over 78% are willing to take the vaccines if it is made available to them. So it is access and availability. And manufacturing, the process that we have begun now, we are very confident that within the next 2 years or so, we will significantly be making significant steps towards that 60% of vaccines produced in Africa by 2040.
Professor Madi, I want to just quickly come to you here for your take on this as well. What can we look forward to now in terms of vaccine production, and how quickly can we start seeing vaccines produced in Africa rolled out on the continent?
So we certainly could see vaccines being produced on the continent within a space of 2 to 3 years, and I think that's a very, very realistic target. But there are bigger issues at play, and that is the sustainability of those sort of manufacturing facilities. So one of the major barriers, and South Africa is a classical example, in that vaccines used to be produced in South Africa until 1998. And in 1998, the government decided to shut down those facilities, and not because we didn't require the vaccines, but rather because we couldn't compete with the likes of Serum Institute and others that are able to produce doses at a cents rather than dollars per dose. Now, the reality on the African continent is very few African countries actually procure vaccines on their own through their budget. They're completely dependent on UNICEF, Gavi, and a whole range of other institutions to procure vaccines. Now, whether those institutions are going to be willing to buy vaccines that cost 5 to 10 times more from manufacturers on the African continent for those facilities to be sustainable, as opposed to procuring vaccine at the nominal price through Serum Institute of India, as an example, that's highly debatable, unless governments are actually willing to pay a premium price because vaccines are being produced on the African continent. Unfortunately, I fear that much of the current energy surrounding the development of these manufacturing facilities are not going to be sustainable.
I want to go now quickly to some questions from our audience, and I'd like our panel to just stand by and take a listen. I'm going to come back to you for some answers to these questions. Take a listen.
So my question for them is that why are they imposing the vaccine on us if there is no conspiracy theory behind that vaccine?
A lot of people are saying that a lot of people are wondering, how does the vaccine affect fertility? And why don't we have just one vaccine, as in the case of polio?
Dr. Fourie, I'm going to come to you shortly, but Fiona, I just want to ask you, as you heard there, people are asking about why is this being imposed on us? Why are we being forced to take this vaccine? This is a question that has led to protests in many parts of the world, as we've seen. When you hear people, Fiona, talk about this, and also we've heard another question, why isn't there just one vaccine, as in the case of polio? Fiona, what do you say to people who feel that this is being forced on them and who ask why there are so many different vaccines?
I must start with saying that vaccines are effective for protecting people from this, in particular the COVID vaccine, from severe disease, hospitalization, and death from the COVID-19 vaccine. Well, and while African governments have an obligation to protect their people from these serious public health threats, WHO does prefer that the vaccine uptake is achieved without the use of mandates. And mandatory COVID vaccination should be an absolute last resort and only applicable when all other feasible options to improve the vaccine uptake have been exhausted, especially community engagement to espouse the benefits of the vaccine and to address any hesitancy as a result of misinformation. That being said, are vaccines being forced on people? Because when it comes to a pandemic or an epidemic or what we normally call like an outbreak, this is a public health threat. This is something that is not individualized. It is different for one person deciding not to go for antenatal care, for example, a pregnant mother, and having issues with her delivery. But this is different from someone refusing to cut the bushes around their house and mosquitoes and draining the water, and then mosquitoes are all over the place, and the whole community starts getting an outbreak of malaria. So when it comes to public health, much as the vaccine should not be forced on anybody, it is not just individual protection. The protection of the individual is protecting the whole community and the whole population. So the mandate and the responsibility lies with the public health department or the Ministry of Health or the government to protect its citizens. So much as we do urge governments to take into consideration that many reasons that their citizens may not receive the vaccine, for example, the lack of access and misinformation, to consider those and address those before invoking any mandates. So when it comes to the question on the why are there different types of vaccines and not just one? Vaccine development involves several stages of approvals, of even the studies, then approvals, and then many candidates do not make it to the end. That we should know, that there were several hundreds of candidates, but we are only seeing a few tens of candidates that have made it to the end. Typically, many candidates will be evaluated before they are found to be safe and effective for use in humans. And having lots of different vaccines in development processes increases the chance that there will be one or more successful ones that can be shown to be safe and effective for use for the prioritized populations. Now, when COVID-19 struck, it became apparent that this was a global crisis that needed to be addressed very fast. So we couldn't depend on one particular site. And like I mentioned, because the processes are long and many of the vaccine candidates don't reach the end, we needed to have different types, different places, different governments, countries, vaccine manufacturers, researchers came into play in parallel to ensure that we had something out there as quickly as possible. They labored to find these vaccines. And secondly, we needed to contain the virus by vaccinating as many people as possible. And we have been lucky, and those of us who believe in a supernatural power, God has been on our side, that we've been able to find a number of vaccines. Now we have a number, lots of different, not only types, but doses that can be used to vaccinate as many people as possible for us to get out of the pandemic. We all want to get out of where we are right now. And we would urge everybody to go and get your vaccine. And if you're eligible also for a booster, go and get your booster dose, because we need to get back to normalcy and get our economies running, get back to normal life. Thank you.
Thank you, Fiona. Dr. Fourie, this question that seems to be a very persistent, could we say myth or lie about COVID-19, is that it affects a woman's fertility or her ability to bear a healthy child. What is behind this myth? What's fueling it? And what do you say to people who use that as perhaps an excuse, or influenced by that as an excuse not to take the shot?
No research to date has shown that the vaccine could actually cause any issues with fertility. In fact, a study from New York City just showed that came out in December of patients that are going through in vitro fertilization. They compared patients' embryos, chromosome, and the pregnancy outcomes in patients that were vaccinated and unvaccinated. And there was no difference amongst the two groups. So we have many data now, especially 2 years after the vaccine has been available. There are many data supporting that the vaccine does not cause any issue with fertility or pregnancy. And I have shared my own personal story that how I received the vaccine while I was 24 weeks pregnant in December 2020, very early on, when we didn't have this much data about the safety of the vaccine among pregnant populations. But at the time, from the studies of Pfizer and Moderna, people that were in the study who ended up becoming pregnant, it showed that there was no harm on their baby or on their pregnancy. So that reassured me, and I got the vaccine since I work on the front line and I was a high risk, also for the sake of protecting my own baby and my own family. And there's so many healthcare professionals now who are pregnant or who plan on becoming pregnant who received the vaccine. There are people who received the vaccine and became pregnant with no issues. So unfortunately, there's a lot of misinformation about that. And it just comes from, social media and from these influencers that have no medical background.
I want to quickly, we do not have a lot of time left here. I just quickly want to ask to play another set of questions from our audience. And I'd like Professor Madi and Dr. Umar to just please take a listen.
So I'd like to ask them if they could explain a lot clearer about what they're doing, especially with the mRNA vaccination. I think a lot of backlash has come because people don't understand what that is. And for me, the way I look at it, it's it's a newer technique for delivering the vaccination. And if people understood what was actually happening there, they'd probably be more apt to take the vaccination.
Professor Madi, I don't know if you've ever had this many questions about what exactly you and your colleagues do in labs as you do these days, but in the very simplest of terms, we heard there people asking, what is in the COVID-19 vaccines? And can you tell us more about the messenger RNA vaccines in the very simplest of terms so that all of us can understand?
So what the messenger RNA vaccines are, and similar to the non-replicating vector-based vaccines at the AstraZeneca and the Johnson & Johnson vaccine, is that they're taking the genetic material that codes for a part of what is referred to as a spike protein, which is very important for the virus to attach to cells. Now, that genetic material is delivered into the muscle, and it uses a muscle machinery to produce this protein known as a spike protein, which is then presented to the immune system, and that stimulates the immune system to produce antibodies as well as to activate other components of the immune system known as T cells. So once that occurs, essentially you've got protection against COVID and especially against severe disease. On the other end, the protein-based vaccines, as an example, is not making use of the muscle cell to produce a protein, but are directly injecting the same protein into an individual. Importantly, with the messenger RNA vaccines, and I think this has been one of the concerns, is that it does not affect the human genome. So it's not integrated in the human genome, and it's not going to cause long-term problems. So in a summary, basically we're using genetic material, injecting it into the muscle cell, and taking advantage of the muscle cell machinery to produce the same sort of protein, which otherwise we can also deliver directly into an individual to stimulate the same sort of immune response.
Professor, I think I got some of that, and now I know why my report card said that I'm not living up to my potential. Before we close here, Dr. Ouma, I'd like you to tell us where you see the path for the continent going next, where the focus is going to be in terms of investment, and what are the areas that make you feel hopeful, and where do you think we really, really need more work?
As we celebrate 5 years anniversary of Africa CDC, I'm even more hopeful because there are very concrete strategies and structures that are being put in place to address health security issues. So I'll share two. One reason that makes me hopeful is that the continent has appreciated that they must develop their own supply chain internally for everything. Simple things like masks and more complex things like vaccines. We need to develop our own supply chain. That makes me very hopeful because it means we are going to put jobs on the table for Africa. We are going to remove the doubt of response when any disease outbreak comes. And thirdly, we are going to secure the way in which we access our health products. The second thing that is making me very hopeful is that not just our political leaders, but also our scientists and young professionals have completely been sold on the need to fully engage with the public health situation on the continent. They are all contributing in their own way, and every time that we try to put out a call for anything to be discussed, Africans are coming out in their tens and hundreds to be able to discuss, make a contribution where it is necessary. This makes me very hopeful that we are not only believing in ourselves, but we are also putting our expertise, our knowledge, our resources on the table to be able to turn that belief into something that is concrete. I'm very hopeful for this continent, and despite everything that has been said before, the experiences we've had in the past, we have turned over a new leaf. We are in a new page, and I am looking forward when I retire in a few years that the health security agenda on the continent will be on a totally different plane than where it was before the pandemic. Thank you.
Well, every crisis indeed leaves plenty of opportunities. Dr. Ouma, thank you so much, and thank you to the rest of our panel for giving us your expertise, sharing that with us, and of course giving us your perspectives. Dr. Ahmed Ogwell Ouma, the Deputy Director of the Africa Centers for Disease Control, Fiona Atehebwe from the World Health Organization, and Professor Shabir Mahdi from the University of the Witwatersrand in South Africa, and Dr. Sion Faru from Columbia University. Thank you so much, ladies and gentlemen, for sharing all of that with us. We do hope to have you on the show again soon. We did end this on a bit of an optimistic note, so thank you. Great way to close our town hall this week. And a big thank you to our affiliate stations for airing our show across the African continent. And of course, to all my wonderful colleagues, our team of reporters, camera people, and production teams here in Washington and on the African continent. Thank you for joining us on television, radio, and online for this town hall edition of Straight Talk Africa. Until the next time, goodbye.